The Connecticut Hospital Association is pleased to present the 2026 John D. Thompson Award for Excellence in the Delivery of Healthcare through the use of data to Yale New Haven Hospital for its high-risk patient MRSA prevention initiative.
I am the patient services manager for the surgical ICU. I've had my share of caring for some very sick patients. Last year, I relapsed with my Hodgkin's lymphoma, and in July, I had a stem cell transplant. I was inpatient for about 3 straight weeks. You know, you go from understanding and knowing the system to now you're relying on it to take care of you. We had implemented this practice of using the nasal swabs for our patients twice a day. When my treatment team told me that this was going to be part of my treatment plan, I just felt like, wow, this is great. This is extra protection for me.
The issue for us really became using hand hygiene standards, using chlorhexidine bathing, using isolation precautions for MRSA only moved the needle so far because we're not addressing the main reservoir of where Staph aureus lives in the human body, which is the anterior nares.
So what we decided was to use an ethyl alcohol nasal swab, and that would be administered 2 times a day to high-risk patients. And those were our patients that were critically ill and had a lot of devices.
The beauty of the alcohol nasal swab, which is actually ethyl alcohol, is that it is effective against MRSA, and resistance does not develop over time.
This novel approach had been studied in smaller settings like long-term care, not really any hospital acute care settings. We knew that this was going to be a challenge and we needed to treat it more like a public health initiative. We brought in supply chain, we brought in our nursing partners, we brought in the EMR, we brought in pharmacy, and a lot of other key stakeholders. We built a report that would actually track every application given, if it was given, if it was not given, if it was refused. And then that would go to an external report that then would track and trend every unit.
We bundled it in order sets where they were already bathing patients and doing other patient care. So it felt natural as part of their workflow.
That's how we audit this, to make sure patients are receiving it. If this works, this is a win-win on many levels. For the patient, for the institution, and for medicine as a whole.
Overall, we've reduced these bloodstream infections, I'm very proud to say, by 50%. I know upwards of 5 to 6 patients per year are not having an increased length of stay, are not going to our ICU, are not potentially dying of this life-threatening bloodstream infection.
And I think that was really a testament to leadership within the organization to really let us pursue this intervention.
Hospital-onset MRSA has been a scourge in healthcare for at least 2 decades and can cause a significant degree of morbidity for patients and even mortality. So new attempts, innovative attempts to really make a difference in the lives of our patients are very, very meaningful. So I'm very proud of the team for taking an idea and turning it into action, and taking out a belief and turning it into lives saved. Patients received a lot of education about the why. Why is it important to do these nasal treatments twice a day? And by that education, it gave the patients agency in their own care, and I think was really part of the success factor for this project.
They did their nasal swab and we became partners in this. That little action of a nasal swab twice a day created such a sense of trust with larger things, right? They must be taking care of me in a well-detailed way and looking out for me.
I share my story whenever I can to patients, to the staff, to the family members. It protected me. It protected me for 3 weeks, and I walked out of here with no complications.
Thousands of patients get this treatment every week. We feel like even one prevention of patient harm is so important. It's not necessarily that we have to go out there and have 500 patients saved, right? It's every single patient.
That's what's driving all of us to do what we do in healthcare every day. A novel but simple intervention can change lives. And that is something that is so powerful for us to remember in our complicated world of healthcare.